What we are going to have new is a new treatment for the macular disease. IMAX IOL, can you just show the video? All ARMD patients hardly have any option
OLAMD's
other than low
IMAX
vision
Mono
aids.
is a
Once they're already scarred or
groundbreaking
in the dry
intraocular
AMD
device
stage.
for
But we
improving
are really
vision in
excited now to
patients
have
with
IMAX
macular
IOL
disease.
now in India, which is available from
Age-related macular degeneration, known as AMD, causes visual distortions and the loss of central vision, making it difficult to drive, see faces, or read. Vision loss is normally gradual, occurring over many years, and peripheral vision is not affected. AMD is the leading cause of visual impairment in the developed world, and it is estimated that many tens of millions of patients could benefit from a specialized lens solution to help with their AMD symptoms and improve their quality of life. Unfortunately, many sufferers still believe that nothing can be done. In a world first, the team behind the award-winning IOL AMD technology now offer an advanced AMD treatment that incorporates the benefits of IOL AMD and IMAX into a single lens. IOL AMD's IMAX Mono is the world's most advanced intraocular lens for AMD. It's injected into the eye via a tiny sutureless incision. If IMAX Mono is implanted during cataract removal surgery, the lens will be placed in the capsular bag, similar to most modern intraocular lenses. When IMAX Mono is implanted in a patient who has previously undergone cataract surgery, the patient's existing intraocular lens will remain in the capsular bag, and a different version of the IMAX Mono lens will be placed in the sulcus, just behind the iris. IMAX Mono lenses feature unique and advanced optical characteristics which could improve the vision and lives of tens of millions of patients. Once IMAX Mono is in place, it cannot be seen from outside the eye. Standard monofocal lenses produce sharp images in the center of vision, where the macula is located, but are not as sharp in the periphery. When a patient has macular damage, they will often compensate by shifting their focus to a healthier section of the retina, and the standard monofocal lenses leave these patients with blurry vision where it is needed the most. A greater improvement is now possible with IMAX Mono. The effect of the IMAX Mono procedure is to gently magnify the incoming image and provide a higher level of clarity across all areas of the surrounding retina. This can provide significantly improved sight for patients who are not using the macula for central vision. When implanted in both eyes, the brain can utilize images from the healthiest parts of each eye in combination. This can reduce the negative effects of damage in one eye by filling in the visual gaps from healthier areas of retina in the fellow eye, creating a composite image that maximizes the patient's potential visual ability. If the macular disease gets worse over time, the patient can shift their focus to the area of healthiest retina, giving some protection from future disease progression. The entire surgical procedure takes around 10 minutes per eye and can be performed under local anesthetic. In addition to AMD, the IMAX Mono lens may be beneficial for patients with other forms of macular disease, including diabetic maculopathy, macular holes, myopic degeneration, and hereditary retinal diseases such as Stargardt's and Best's. Depending on the visual potential remaining in the eye, an IMAX Mono patient could regain the ability to drive, read, or see faces, significantly improving their quality of life. A trained IOL AMD eye doctor will be able to explain prior to surgery what visual improvement could be achieved. If you are interested in learning more about the IOL AMD IMAX Mono procedure, please visit our website at www.iolamd.com.
So for AMD, we had a previously telescopic IOL which had very large incision, very bigger size and lot of complication. Then it came under mini telescopic IOL. Then we had a Hubble IOL, which was a combination of two different powers in the eye. But now what we have is a IMAX, which is a hydrophobic acrylic material, which is a special hyper wavefront design, and it gives an eccentric, that is a 10-degree eccentric from the macula, and it magnifies your image. So magnification is almost 1.2x. The case selection is very important for the initial few cases. So you need to select your cases which are macular scar either because of dry AMD or a regress stage of wet AMD, somewhere vision between 660 to 612. That is the ideal case. Again, you need to have a binocular rather than selecting only one eye initially, which one eye magnify image and other eye normal image, patient will get a diplopia. So you need to have very binocular patient which can easily go. Don't select very scarred macula in the beginning, and it just goes with your standard 2.8 millimeter incision. It's a hydrophobic acrylic material. So now it's available in India, and definitely initial case selection is very important. All these patients, you can always try with the first low vision aids, that is a telescopic normal monocular telescope. If patients are really improving, you can suggest this patient, and especially for binocular cases. We don't have Dr. Pavla who was supposed to give this talk, but his insights are there. Can you run the other video? Yeah. Please start.
Good afternoon, everyone. Thank you, Fritz. Thank you, Bobby, for getting me part of this exciting group. Now, what I would do this afternoon with you is share my clinical experience with this lens. I'm lucky enough to be part of this group since the beginning, so I have like 1.5 years experience with this product. Now, as you've heard, this IOL is specifically designed for patients that have macular disease, and the way this lens works is basically giving a good quality picture up to 10 degrees away from the central macula. Now, as Professor Hartal has clearly explained it before, a standard lens gives you a good picture in the center, but a bad picture is in the periphery, and that's good for a standard patients. Now, AMD patients, they do not use most likely their central part of the macula, they're using their peripheral macula, and they're not getting that good of a picture over there. So one way to improve their vision is with these optics, and the other way to improve their vision is by magnifying the images, and that's obtained aiming at post-op refraction on the hyperopic side, and I will go into details on how we choose our post-op refraction on each patient. Now, as it was clearly explained by the other speakers, this is how a standard lens is working. It's giving you a sharp image in the center, but not as sharp in the periphery. But if you have AMD, then you're not using your central part for vision, you're using a peripheral part of your macula, and then you're using an optical system which is not optimized to give you a good image there. What happens with this lens is that you're gently magnifying the image, and you're also giving them a good quality picture up to 10 degrees of peripheral macula. And that's what's actually making the game work. So I will be sharing with you my...
So good part about this lens, you can put it in a normal phakic patient who are already having a dry RMD or with scarring as a first implant. Or if your already patient is pseudo-phakic, you can get a customized implant made as an add-on lens, that is an IMAX add-on. So that is also possible. So initial good case selection is very important, and now it's available with the care group with us. Any questions on this and for trifocal? Any question? So we'll close the session. Thank you. Yeah.